right, folks, I have 12:02. We're going to get started here and introduce the meeting and get going here. Just so everybody knows, we are recording the session, so your continued participation is your consent to being recorded. We wanted to schedule this meeting for all of you with the discussions that are taking place in Washington, D.C. around budget reconciliation, the potential for changes to SNAP and Medicaid. We put together some resources that we think will be very helpful to you to take a look at some data and understand how your county residents who are relying on important programs could be impacted by changes. First of all, it's important to stress to your constituents, none of the changes have been made at this point. So nobody's health care has been impacted at this point. We are still here to assist them with their health care and behavioral health needs. Our presenter today is Chuck Terrell. He's the Director of PeopleStat, or Performance Management Office at the Department of Human Services. He's going to walk us through and share how to find important information specific to your county. It's intended to help you understand the impacts, and as you have conversations going forward, as more conversations ramp up in Washington, and to be able to respond to your constituents. We're also going to touch on some of our program integrity efforts here at DHS to demonstrate how we're safeguarding critical resources. Again, the session is being recorded. If you are staying on the call, you're consenting to being recorded. We'll do our best to make the recording available shortly after the session. Please keep your line muted to assure that we have the best sound quality. We will take some questions and comments after the presentation. If you'd like to comment or you have a question, please type into the chat box, "I have a question." We will then call on you and we will unmute you so that you'll be able to speak at that point. So at this time, I'm going to turn it over to Chuck Terrell. Thank you, Chuck, for being with us today.
Thank you, Brenda. And as Brenda said, I am Chuck Terrell. I am the Director of PeopleStat here in the Department of Human Services. And what we wanted to show you today is some data that we have compiled on Medicaid and SNAP, and we'll also talk a little bit about program integrity, to help you understand what might be some of the impacts that are occurring based upon the discussions occurring at the federal level. And as Brenda indicated, nothing has changed. Our programs are operating as they always have. But I thought it was important to tell you what's currently occurring and give you a sense of who in your counties are receiving these services. So, let's see. So Medicaid in Pennsylvania, as you may well know, it's a healthcare program that's overseen by the federal government and it's managed by the states. Funding comes from both the federal government as well as the state. And in Pennsylvania, we cover 3 million individuals on Medicaid who live in every county. It's children, people with disabilities, low-income families, and older Pennsylvanians. When we talk about Medicaid, and in the numbers I will show you here, unless otherwise stated, we're talking about services related to physical health, behavioral health, and long-term care. So the other thing I did want to mention that we're going to touch upon is Medicaid expansion. So Medicaid expansion occurred in Pennsylvania in 2015. It was part of the Affordable Care Act, and it allowed us to expand Medicaid coverage to a group of individuals who previously did not have that coverage. And that was primarily people of working age between 19 and 64 who did not have a disability. Eligibility for Medicaid expansion is up to 133% of federal poverty. And just as a reference, that means as if you're a single adult and you make less than $21,128 a year, you would be eligible. If you are a parent who had 2 children, the amount is higher. It would be about $35,978, meaning you needed to make less than that to be eligible for Medicaid under Medicaid expansion. Medicaid expansion provides both physical and behavioral health services. And as I indicated, these services were not previously available to folks. So in terms of the data, when we look at January 2025, which is our most recent data, we have a little over 3 million Pennsylvanians who are covered by Medicaid. So that's 23% of the Pennsylvania population receives their health care through Medicaid. And what I want to do now is I'm going to move to our website, and it'll just take me a minute to switch here. And the website we just put up, and it contains data on Medicaid expansion and Medicaid. And we've structured it such that we're hoping that you'll be able to easily use the data on this dashboard. So I just put it up, and Brenda, can you confirm that now you can see the web page?
Yes, we can see the
Okay.
web page now.
So when we share the PowerPoint, it has the link, but we've also made it very easy for you to get there. Just Google PA DHS data. That's PA DHS data, and that'll bring you right to this page. So some of the information I already discussed is in the front of this page. But the first thing I want to show to you is the first map. This is Medicaid enrollment as of January 2025. And you see up here, we have the total state enrollment. And as I mentioned earlier, that's a little over 3 million, and that's 23% of the Pennsylvania population. What I have below in the map is a map here, and you can hover over your county, and when you hover over your county, you can see it shows you your enrollment, your percent of populations in Medicaid, and your county population. So I've just put over Potter, and in Potter, there's 3,675 individuals enrolled in Medicaid, and that's 22% of the population. The colors here indicate what percentage. So in Philadelphia, they have a higher percent of their population. That's why they're green. You see below the legend here explains this to you. When we look over here to Fayette, they have 31% of their population who's on Medicaid, and Luzerne has 31%. So the colors for each county indicate where they fall along sort of the spectrum of percent of population on Medicaid. The other thing you can do is up here, you can filter for your county. So when we do so, if you wanted to filter for your county, you would just first click get rid of the all, because right now we're showing all counties. And let's say I want to show Allegheny. So I hit Allegheny, and then below here, I hit apply. And this may take a minute to update, but when you do so, it'll show you Allegheny's specific data. So this data here for Allegheny indicates 246,877 individuals in Allegheny County are on Medicaid, and that represents a little less than 20% of their population. You can also select more than one county if you wanted to compare, and that would appear on there as well. I'm going to go back and just show all counties. The next thing I want to show is you can filter by age range. So, sorry for keep moving there. So that we have 3 age ranges you can show. Right now we're showing all ranges. You can show less than 21, which is under 21 is considered children in Medicaid. You can show those who are 65 years of age or older, or those that are between 21 and 64. So what I'm going to show here are those less than 21. So I click on 21, and then I hit apply. And then what we have here is it shows now the enrollments for those under age 21. So in Pennsylvania in January 2025, we have 1.2 million individuals on Medicaid, and that's a little over 39% of the population. So that means 39% of children in Pennsylvania receive their health care coverage through Medicaid. And just like with the previous map, you can hover over a county and to see what the percentage is and the enrollment. So here in Westmoreland, we see they have 26,954 children on Medicaid, which represents 35% of the child population in Westmoreland. And again, the age range, the colors here are based upon the age range here. And you'll see, you know, we have some counties. So for example, Northumberland, they have 10,278 of their children on Medicaid, and that represents 50% of their population. Over here in Venango, they're also almost at 50% as well. So again, if you wanted to just look at a specific county with this age range, you would, you know, click on the all to remove that. And let's say we want to look at Bucks. And then if we look at Bucks, it'll apply. And the data then will come up here for Bucks County. And for Bucks County, it'll show you that they have 39,850 children on Medicaid, which represents 26% of their children receive healthcare coverage on Medicaid. So there's a lot of different things that you can do with this map. It will be updated every month. So you can look back about the second or third week of the month. This will be updated for the most recent month. Moving down here, there's some more Medicaid data. And here you can, this just provides the same data above in terms of individuals receiving. This is total individuals. So if you prefer in a table format, you can do that as well. We have also provided the data by different legislative districts. So this represents the congressional districts in Pennsylvania, and we have it by the congressional district number. And we're showing for each congressional district how many are enrolled who are under 21, how many enrolled that are between ages of 21 and 59, and how many enrolled that are over 60, as well as how many are enrolled because of Medicaid expansion. So these are folks who are eligible Medicaid only because we expanded it. So we have this data by all the different congressional districts. We also have the data by the Pennsylvania House, so all the different House districts, as well as the Pennsylvania Senate. So in case any of your representatives or Pennsylvania senators are interested, they can obtain the data here to inform them how many of their constituents are receiving Medicaid. So the next thing I wanted to demonstrate to you or show to you is Medicaid expansion. So as I indicated, Pennsylvania expanded Medicaid in 2015, and it allowed us to provide coverage to people who are working age adults between the ages of 19 and 64 who would have otherwise not been able to obtain healthcare coverage. The map here, this is a little bit different than before. It's not an interactive map, but what it shows you is what percent of those between 18 and 64 are covered by Medicaid expansion. So, for example, here, if you look here, it looks like this is Allegheny. That's their 8.35% of their 18 to 64-year-olds are covered through Medicaid expansion. Statewide, 1 in 10 people between the ages of 18 and 64 get healthcare coverage because of Medicaid expansion. So this map is showing you the percentage of those populations. We also have a table below that explains to you of the number who are enrolled in Medicaid expansion by your county. So this first column here is the number of people in a county that are eligible for Medicaid because of Medicaid expansion, and this is the percent of 18 to 64-year-olds who are on Medicaid expansion in the county. So again, this data is available at the county level. You can go here to see how many of your residents in your county receive Medicaid expansion. The other thing I wanted to show is something that we just put up on the web page. So as I indicated, with Medicaid expansion, it includes behavioral health services. So that's obviously through the Behavioral Health Choices program, which I'm sure many, if not all of you, are familiar with. It is a program that we partner with the counties, who are the main contractor in most perspectives, in providing the managed care services to those on Medicaid for behavioral health. So what we have done is, for the fiscal year 23-24, the state fiscal year 23-24, we looked at all people who are eligible because of Medicaid expansion, and we looked to see how many of them got a behavioral health service during the year, and what was the total spending for those behavioral health services. So in this table here, you see statewide 219,000, a little over 219,000 individuals who are on Medicaid expansion. This is just Medicaid expansion. This is not everyone on Medicaid, but just Medicaid expansion, who received a behavioral health services. And in total, that was just under $900 million that was spent for those services. So we're bringing this up because obviously there are discussions at the federal level about what to do with Medicaid expansion. There have been proposals about potentially reducing the amount that they provide to the states. As I indicated before, 90% of Medicaid expansion is paid through federal funding. The state pays 10%. There's been discussions about potentially that going down to the level for regular Medicaid, which is 56%. So that would be a significant shift to the states to provide this coverage. There's been some other discussions about that could impact Medicaid expansion coverage. So we thought it was important to understand what is it in terms of behavioral health that is being spent. So you will see we break this down by individual county. It shows you the number of individuals in your county who in that state fiscal year who are on Medicaid expansion got a behavioral health service, and what was the total amount spent for those. So in Adams County, there was a little over 1,300 individuals on Medicaid expansion who got a behavioral health service, which cost a little over $2.3 million for Adams County. For Allegheny, it was 21,354 individuals on Medicaid expansion who got a behavioral health service, and that spending was a little over $96 million. So another related table we have is then we drill that down to understand what are the diagnoses. So here we're looking at 3 diagnostic categories. And we got this data from the Medicaid claims data, which is submitted to us through the counties and the behavioral health managed care plans. And again, this table is for those who are eligible under Medicaid expansion. So statewide, there were a little over 62,000 individuals on Medicaid expansion who had a substance use disorder. Of those 62,000, a little over 31,000 had an opioid use disorder. You see the number right here. And then we also wanted to understand how many of the Medicaid expansion recipients had a serious mental illness. So statewide, again, the number was 125,000 individuals on Medicaid expansion had a serious mental illness. So those are the statewide totals. And again, we've broken this down by county, so you can pick out your individual county to understand what are the different diagnoses in your county for people who are receiving or covered through Medicaid expansion. So next up, I wanted to talk about SNAP. There's also been discussions about making changes to SNAP and potentially modifying the funding that is provided to recipients in SNAP. The one thing I will mention to you, SNAP, as you may know, is 100% federally funded. So the dollars that individuals receive who are on SNAP comes from the federal government, and it's 100%. So the first dashboard here for SNAP is exactly the same as the one I showed you for Medicaid, except it contains data on SNAP. So again, we see that in Pennsylvania, we have a little over 2 million individuals who in January 2025 were enrolled and receiving SNAP benefits. And that represents a little over 15% of the Pennsylvania population. So a little over 15% of the Pennsylvania population receives SNAP benefits. As before, we have a map here, and the color gradations is based upon the percent of the county population that receives SNAP. So again, if you hover over a county, and I hover over Fayette here, you see that 24% of their population, county population, is enrolled in SNAP. We go up here to Luzerne, we see that 22% of their population is enrolled in SNAP. As with the above map before, you can break this out by age groups. So again, if I show children, hit apply, the data up here now will be for anyone under the age of 21. And you will see that 769,000, a little over 769,000 children are receiving in a household that is receiving SNAP benefits. And that's about 24% of children in Pennsylvania. Again, the map here will show you the different percentages and numbers for counties. So for Erie, we see that 33% of their children are enrolled in SNAP, and that number is 23,011. As before, you can select a county here as well. I won't do that again, but if you wanted to select a specific county or to select Adams, just select Adams and hit apply. And the data for Adams will appear. And since I'm still showing less than 21, it will show the data for Adams. And I think, yep. So what you see here in the map is that in Adams County, there are a little over 3,700 children enrolled in SNAP, which represents a little over 14% of their population for children. Again, as before, below the map, we have a table that contains the data for the total enrollment in SNAP for your county. We have also provided a breakdown by the congressional districts here, and we break it out by the different age ranges. So again, if you wanted to share with your congressperson, we have the data there available. We also have it available for the Pennsylvania House and the Pennsylvania Senate. The other map we wanted to provide, you will see here, is how much SNAP benefits are issued in a month. So these are SNAP benefits that go directly to an individual and that they use to buy food. So again, SNAP can only be used for food and for no other purposes. So the map here shows how much, and in this case, in December 2024, for that month, how much was issued. So in Pennsylvania, there was a total of 366.8 million SNAP benefits issued in just that month. The map here shows you how much was issued in each individual month. And I think one of the important aspects here is it's not just the amount that helps the person purchase foods, but it's also money that goes to local grocers and other food vendors who are eligible under SNAP, a SNAP store. So this has an economic impact to your local counties if these amounts get reduced. And the United States Department of Agriculture is noted here, noted that for every dollar issued in federal SNAP benefits, it helps grow your economy by $1.54. So I think that's something also important to indicate. It's obviously a significant benefit to low-income families and individuals, but it also does have an impact to the stores where they use their SNAP benefits. So the last thing I wanted to bring up as Brenda said, is we wanted to talk a little bit about program integrity, because that is something that has been brought up as a potential area of savings in Medicaid. And we're going to be putting some data up related to program integrity in the coming weeks. But I just wanted to give you a little bit of overview. First of all, when somebody comes and applies in Medicaid, there are 12 data exchanges that we go through before we even determine that they can be enrolled in Medicaid. We check with the state labor and industry related to wages. We also check with the federal IRS for income and wages. We check for their deceased persons database that we get from the Department of Health. And these checks are ongoing. So it's not just a one-time thing, it's ongoing. We check with the Department of Revenue for lottery winnings, so that if somebody were in a lottery that would make them income ineligible, we would know that. So as indicated, there are 12 checks that we do on an ongoing basis to make sure that person is eligible for Medicaid. And then, like all state Medicaid agencies, we're required to have a program integrity program. And in DHS, we have a whole bureau that is responsible for program integrity. Their responsibility is looking at not only what payments we make in Medicaid, they also have a responsibility to check to make sure individuals don't have other third-party resources to pay for their health care. Medicaid is a payer of last resort. So meaning if a person has other healthcare coverage, other third-party coverage, that pays first. So our Bureau of Program Integrity does these checks and makes sure that in all cases we are the payer of last resort. When it relates to fraud or abuse, we also do significant activities in terms of looking at it. And it's a very data-rich approach using predictive analytics and artificial and AI when we look at claims data that's submitted. In state fiscal year 23-24, our Bureau of Program Integrity recovered almost $52 million in Medicaid payments that were identified as fraud. So we actually recovered that. We actually terminated contracts for over 300 Medicaid providers for whom we determined participated in fraudulent activities. Those get referred to the Office of Attorney General for criminal proceedings, but we also do collect on those individuals as well. So there are significant activities that we are taking to assure that the dollars we spend in Medicaid are for proper payments and are not for fraud. So with that, I'm done with my presentation, and we're happy to take any questions or comments that folks might have.
So folks, if you would type into the chat box that you have a question, we'll recognize you and unmute you. And give folks a few minutes here to absorb. All right, we're going to call on Zachary Gates. Zachary, I'm going to unmute you.
Thank you. On the SNAP benefits per county, do you have available data on where the SNAP funds are being spent, meaning whether they're being spent at a particular store chain or Dollar General or et cetera? Because that would, I imagine, be something that might be interesting to folks like me.
I'm not sure, and if it could be proprietary, but why don't we get back to you and see what level of detail we can provide in terms of where people are going in a county in terms of using their SNAP benefits.
Thank you.
Commissioner Parker asked for the website address again. I did just place that in the chat box.
And I think we'll send out the PowerPoint as well, and that'll have a link to it. So.
Other questions, comments, suggestions? Shireen Hess, Commissioner Hess, go ahead, please.
Hi, everyone. My question is is there a way to identify folks who should be, who are eligible for these programs, but are not enrolled? I know that's kind of a big question. And also, is there a reason that there's a disparity in some cases, like between the percentage enrolled in Medicaid versus the percentage enrolled in SNAP? You would think they'd be closer together, but in some cases they're not. Any thoughts on that?
Yeah, so I think to your first question, if anyone is eligible, we can also send out the link. They can go to Compass. They can also call our consumer line. They can help people sign up for Medicaid over the phone. We encourage it's most efficient if people can go online. Our Compass system was just updated, so you can use your tablet or phone to apply. So, and Brenda put that up there. That's the best way to do that. So we encourage if anyone is available. We do have community partners across the state who do help people get enrolled. These could be hospitals, in some cases local food banks, or other nonprofits do help individuals get enrolled into the programs. But it's best to start with Compass. It helps people identify what they may be eligible for and gets them started in the enrollment process. On the second question, it is interesting, and I think it is something we have noted. There are different requirements for how people may be eligible between Medicaid and SNAP. While SNAP does have a higher income threshold, there are some other aspects of Medicaid that may result in people becoming eligible. For example, people who are on Medicare, people who have a disability status and are on SSI can get enrolled into Medicaid where they may not in SNAP. So there are other qualifying characteristics that get people enrolled into Medicaid. I think I said SNAP, enrolled into Medicaid. But we do think there are obviously opportunities for people who are eligible for SNAP to get enrolled. And again, we encourage folks to, you can also apply for SNAP through Compass as well.
Thank you for the information. And just as a follow-up, I was wondering, are there any success stories on identifying folks who are eligible but aren't enrolled yet for whatever various reasons, to sort of maximize the gain of those vital programs? There probably isn't, but just curious if you know of anything.
Know of things in terms of
how to get people to enroll who aren't enrolled.
Yeah, I mean, I think sometimes there are stigmas to some programs. People are concerned about it, but I think explaining to them that this is something that everyone pays, pretty much pays taxes, so they paid money towards these, and it is getting both good health care and access to food is important for them to be able to live a quality life. And I think there are probably different things, and maybe that's something, Brenda, we can think about how what resources we have that the counties or others could use that help explain what the benefits are and why it's important if they're eligible to enroll. So I think we can do that.
And I'll also add, Navigate PA is also a really good place for folks to start. Any commissioner who has constituents who are concerned or seeking benefits, or your human services agencies, Navigate PA is a way that they can be connected with local resources. And from there, a lot of times people get connected with benefits that they're not aware of. So just another thing we can do. But Chuck and I will talk about other resources for you. And Chuck, Zach Gates had a follow-up question.
Yeah, he's very observant. The table below the map is a month behind, so the map is the most recent. We're trying to work on the map gets auto-populated and then the table has to be manually done. So we've just put those up and we're trying to sync them. So the map is the most current. The table below is only a month behind. But thank you for pointing that out.
So happy to hear other comments, answer questions if we can. In the meantime, I would just please ask all of you if you can think of things that would be helpful for you in addressing questions either with your own constituents or with your Senate and House members and members of Congress. Please send those suggestions our way. We'll continually look at what we can be providing to make sure that people understand what impacts are out there and what the opportunities that may be available to us here in Pennsylvania. Other questions, comments?
The other thing I didn't bring up that I wanted to mention, and we may put some more data on this, but it's also on another link that we can give to you. When we talk about Medicaid, and especially Medicaid expansion, one of the impacts is hospitals. So when we expanded Medicaid in 2015, the uncompensated care hospitals were experiencing has decreased by 27% from then to now. Prior to that, for the 15 years from about 2000 to 2015, every year, the state's hospital uncompensated care increased every year. It only decreased after we expanded Medicaid. So the impact on hospitals is significant. And just to give you another perspective on this, when we looked at the last fiscal year in terms of how many inpatient payments were made for the Medicaid expansion population, that's $890 million. So just imagine if the expansion population were to be ended or limited, that would have a significant impact on hospitals because, as you may know, hospitals by federal law are required to take anyone who comes into their emergency room, for example. So if somebody's in an accident, somebody has a heart attack for a pregnancy, birth, they're required to take them even if they don't have healthcare coverage. And that's where uncompensated care can start to build up. So that's another significant consideration, especially if you have some hospitals in your areas who have very low margins, who are struggling. The removal of Medicaid expansion could have an adverse effect on their operations, given the fact, as I said, that over $890 million for that population was spent in the last fiscal year.
Chuck, I believe it's also true that with Medicaid expansion, we saw the direct enrollment for behavioral health with our counties shift a bit to Medicaid. Yep. So if that Medicaid expansion population would be changed and that eligibility change would occur, there is good reason to believe that counties will see more people who are seeking services that don't have coverage that would be expecting the county to find a way to provide them with support.
Yep, and that almost 900 million I had indicated for the Medicaid expansion population, that's a significant amount of money, and we know today counties are really working hard to address the mental health treatment of their population residents, as well as the single county authorities. So those are services we were able to provide through Medicaid. That again, if the expansion population were to be limited or ended, that would be a burden placed on counties.
Commissioner McGonigal points out that the impact on hospitals from reduced Medicaid expansion enrollment would be the same for EMS and ambulance transport, or is asking the question?
I'm not as familiar with that. I mean, I don't know what requirements they would have. I'm assuming if you call an ambulance, someone is going to transport you, and if they don't have insurance, that would have an impact on them. So that as well, because obviously if somebody is covered under Medicaid, we would pay for those services. So an uninsured person, that could have impacts on EMS and ambulance.
Other questions, comments, suggestions? Commissioner Gates, please go ahead.
Yeah, so I just put it in the chat box. So census data has a little bit of a different age break in terms of if you're trying to ascertain what percentage of your, so for Medicaid, it would be, let's say, what percentage of your sub 21 population in a county is enrolled in medical assistance. It's a little bit harder because you don't necessarily know what that number is. Maybe you have it, but census data does it as a break at age 18. So you can approximate, but you're not necessarily going to get a full picture of that.
Yeah, I think, yeah, we got the data from, so let's go back up here. I think I'm still showing my screen for this map. So here I'm showing Bucks. What this shows me is, I see what you're saying is you're interested in knowing. So in this case, I'm showing under age 21.
Correct.
You want to know for your county how many individuals are under the age of 21.
Right. So if I used an example, so in mine, if in my county, Bradford, we have 6,514, so 6,514 children on medical assistance under the age of 21. If I do that as a percentage of my population, it's somewhere, maybe around 12% or a little bit, 13%. Okay. But if I'm looking at the percentage of the number of under 21 people in my county, the percentage of that population is going to be dramatically higher. But I don't have that overarching number of the number of under 21 because my census data only looks at people by under 18 versus over 18.
Yeah. So what I'm showing here, and I think you can do this for your county, is when you hover over your county, it's showing you that the enrollment for less than 21, and this is for Bucks, is 39,850. The total population of those under 21, you'll see county population is 150,024.
Okay, so that's the location where to find.
Yes. So
Okay.
So I've selected under 21, I've selected the county. And again, if I were to say, let's say I want to know everyone that's not an older individual, it then would add those two numbers together.
Got it.
Let's just double check. And that's 80,000 in those two age groups. And you'll see the county population shows that there are 519,608 people between the ages of 0 and 64.
Got it. Okay, it was this chart. This is the map because I think the other map didn't have it. So thank you for that clarification.
Yep.
All right, other questions, comments, suggestions? All right, I'm not seeing any more. Obviously, if something comes up afterwards or you have a question, feel free to reach out. I will do my best to get your question to wherever it needs to go here at DHS to get us the best answer that we possibly can. As I said earlier, if you have suggestions for other things that we should be taking a look at data-wise that we may be able to provide that will help you as we all work through questions about how things may change or policies that are being considered, make those suggestions available to us. We'll take a look and see what we're able to do. But more than anything, we hope that you will make sure that your colleagues understand and that your constituents understand nothing has changed at this point. DHS is still here to help. We are still providing the services that we have, and We are hoping that people will reach out as they need these services. They won't go without medical care or behavioral health services while these discussions are going on. Yeah. So one last call. Questions, comments?
Only because I
suggestions?
lost contact for a second, Brenda. This is Kevin Boozle.
Please go ahead, Kevin.
I saw you recording this. Is there a way I can get it sent to me? Because I missed a piece of it. I'd like to view it.
Yeah, I'm going to ask some of the smart people here after this call if they can help me figure out how to get the recording and make it available to all of you. And we will make Chuck's PowerPoint presentation available. We can either email that out to folks, or I can send it with a follow-up email to everybody.
Perfect. Thank you so much.
All right. Questions, comments, suggestions, anyone? Again, I'm not seeing any. So as we said, we're going to see what we can do with this recording and find a way to make it available to folks outside of the organization. We've heard from quite a few people that couldn't make it today, but they're interested in seeing that. We might make Chuck's PowerPoint available. If you ever need anything or you have questions, you all know how to get a hold of me, I know, and I hope that you will continue to reach out. It looks like our April session will move back to the first Tuesday. I'll get confirmation of that out to everybody as soon as I possibly can. We're probably going to go back and cover some issues around the multi-year growth strategy and make that available so that folks understand what we're doing there with our developmentally disabled populations and our great partnership with the counties and getting services out to people. Also, if you have suggestions for other sessions that we can be providing for you, give me a heads up and we'll see what we can arrange. And at that, I will give you 11 minutes back to your day and into your lunch period. And thank you again for joining us. And Chuck, thank you so much for the excellent information and for presenting it in such an understandable way. And everybody, please have a wonderful afternoon.
Thank you.
Thank you all.